My name is Jennifer Puente, and I will be conducting my head-to-toe assessment on my son today. It is Friday, May the 26th. I will begin by showing you a top to bottom of my entire room. This is my head-to-toe assessment for summer 2023 pediatrics. My son will be helping to adjust the camera, ensuring that all angles are gotten. I will begin my head-to-toe assessment with an assessment of the skin of the head, face, neck, anterior chest, posterior chest, abdomen, bilateral upper and lower extremities. Skin assessment is done throughout, checking for color, texture, temperature, turgor, scars, lesions, bruises, nevi, and edema. His skin is warm, clean, dry, and intact. I don't note any abnormalities. There are tattoos present on his right arm, but no other abnormalities are felt or seen. I begin with the assessment of his skull. His head is normocephalic and symmetric in midline of his body. His hair is blonde and soft. There are no noted infestations present in his hair. There are no lumps or indentations in his scalp. Any pain with that?
No.
No pain is felt on examination. Palpation of his temporal arteries. Any pain there?
No.
No pain with palpation of his temporal arteries. I will now check his lymph nodes, pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular. No noted abnormalities on his lymph node assessment. I will now palpate for TMJ. Open and close your jaw for me. There is no subluxation, clicking, crepitus, or abnormalities felt with that. I will also test cranial nerve 5, which is the trigeminal nerve, by having you open and close, well, clench your jaw for me. Good. No abnormality is felt there. I will test the sensory portion of cranial nerve 5 by having you close your eyes and tell me if you feel a sharp or a dull sensation.
Dull. Sharp. Dull. Sharp.
Cranial nerve 5 appears to be intact. I will now test cranial nerve 7, which is the facial nerve, by having you open your eyes for me, raise your eyebrows, smile, frown, puff out your cheeks, pucker your lips, and blow out some air. Cranial nerve 7 does appear to be intact as well. I will now move on to the assessment of his ears. Assessment of his ears involves an inspection first to see that his ears are symmetric and set properly on his face. Palpation of the pin and tragus reveal no tumors, nodules, or abnormalities. Further inspection of the outer ear reveals no abnormalities. I will now inspect the tympanic membrane. Tympanic membrane is pearly gray, translucent in color. Cone of light is noted. His ears are checked bilaterally. Further assessment of the ears also assesses cranial nerve 8, which is the acoustic nerve. This will be done first with the whisper test. Please repeat after me.
1, 2, 3.
And again.
A, B, C.
Good. I also will be performing the Weber test. Tell me if you hear and feel this vibration equally in both ears.
Yes.
Good. I also will be performing the Rennie test. Tell me when you no longer hear the vibration.
No. No.
Air conduction should be greater than bone conduction. Again, tell me when you no longer hear it.
No. No.
That conducts the assessment of his ears. I will now begin the assessment of his eyes. I will begin by checking cranial nerve 2, which is his optic nerve, by having him take a look at our Snelling chart. Do you mind to cover your right eye? Tell me what the largest line you can read.
E.
And your left eye?
E.
And both eyes?
E.
And I'll have you do this with your glasses on. Largest line.
FPH.
And left eye.
DHJBS.
And both eyes.
DHJBS.
Very good. I also will now inspect his eyes, lashes, brows, palpable fissures. And can you remove your glasses for me? Now I will check his sclera and conjunctiva. His sclera is white, his conjunctiva is translucent and moist. I don't note any abnormalities. There's no infestations to his brows or lashes. Further assessment of cranial nerve 2, which is the optic nerve, involves testing the central and peripheral vision. Please cover your right eye. Tell me what fingers I'm holding up without moving your head.
2, 2, 1.
Good, and cover your left eye. And tell me.
4, 1, 3.
Good, and now I want you to tell me when you see my fingers.
No.
Good.
No.
Central and peripheral vision do appear to be intact. I now will test cranial nerves 3, 4, and 6, which are oculomotor, trochlear, and abducens. Testing these will involve the pupillary response. This is normally done by dimming the lights. I'm just going to cover his eyes. His pupils are reactive to the light, and a 3 by this gauge. I now will have you, I will check for accommodation and convergence. Just look straight ahead. His eyes are accommodating and reactive to light. I now can document perla. I will check for extraocular movements. I'll have you follow this with your eyes only. No noted extraocular movements on examination. I will finish conducting my eye exam by taking a look at the internal eye structures, his retina, checking for red reflex, ensuring that there are no abnormalities. I don't see any woody bodies or abnormalities. Optic disc is present. I now will begin my assessment of his nose. Assessment of his nose does reveal his nose to be midline of his face. Inspection does not show any abnormalities with his nasal mucosa. You can go ahead and put your glasses back on if you would like. In testing his nose, I will be checking cranial nerve 1, which is the I'm gonna think of that in a moment. Do cover one side of your nose, breathe in and out for me. And the other. Good, and close your eyes and tell me what you smell.
Chapstick.
And again.
Sharpie.
This proves patency of his nares and normalcy of cranial nerve 1, which is the olfactory nerve. Sorry, had a brain fart there. You can open your eyes now, and I will now begin my examination of his mouth, where I will begin with an inspection of the structures, which include, open your mouth for me, his lips, teeth, gums, oral mucosa, pharynx, salivary glands, tonsils. Stick your tongue out for me, the eye. Normal rise and fall of his uvula and soft palate with phonation. Stick your tongue out for me. Move it right, left, up and down. His tongue is midline without any fasciculations. His oral mucosa appears moist. Those movements of his tongue tested cranial nerves 9, 10, and 12, which are the glossal, vagus, and the hypoglossal nerves. They all appear to be intact. I now will move on to the assessment of his neck, beginning with his trachea. His trachea is midline. I now will check his thyroid. I'll have you lean to the right and swallow. Good, and left, and swallow. There are no nodules felt on thyroid examination. I will palpate carotid pulses. One at a time. I also will auscultate for carotid bruits with the bell of my stethoscope. Having you hold your breath for me. Breathe normal. And hold your breath again. Good. No carotid bruits are noted on assessment. I now will begin my posterior chest exam. Examination of the posterior chest involves first an inspection. Noted that there are no forms of tripod breathing or stance. There are no retractions. There's no cyanosis. There are no abnormal respiratory rate, rhythm, or patterns noted. Take a good deep breath in for me. And out. Chest rise and fall and expansion do appear to be normal on assessment. I will be testing for egophony, and I will listen to all of the lung fills, and I will have you to say E for me.
E, 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 E.
This will be done with the bell and the diaphragm of the stethoscope. I will test for bronchophony by having you say 99 for me.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Ensuring that I listen to both medial and lateral lobes, again with both the bell and the diaphragm. I now will check whisper pectoraliquy, and I will have you whisper the letter E when you feel my stethoscope.
E, 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 E.
Good. There were no bronchophony, ergophony, or whisper pectoraliquy noted on assessment. I now will percuss in his intercostal spaces. Resonance is heard throughout. I will now begin the anterior chest exam. It again begins with inspection. I will take note that I did not check for tactile fremitus. I will do that now. I will have you say 99 for me.
99, 99, 99, 99, 99.
Good. And again, I will check for tactile fremitus now.
99, 99, 99, 99.
Good. Overall inspection of his chest appears normal. Take a good deep breath in for me and out. Normal rise and fall of his chest. Again, noting no retractions, no tripod breathing. I'll again listen to his lungs with both the bell and the diaphragm. Going from side to side. Ensuring that I listen in medial and lateral lobes. I now will begin the cardiac portion of my assessment. I will begin with the second right intercostal space, aortic, second left intercostal space, pulmonic, third left intercostal space, first point, fourth left intercostal space, tricuspid, fifth left intercostal space, medial of the midclavicular line, mitral, and you will listen here for a full minute to get an apical pulse. Heart rate is 70 and regular. Valves will be listened to with both the bell and the diaphragm. Locate PMI. No thrills palpated. I now will have you to lie down on the bed. I am assessing for any jugular pulsations at a 45-degree angle. There is no JVD noted. I am inspecting. I do not see any heaves or lifts. I will palpate over each of the valves of the heart, and I do not palpate any thrills. I again will listen to the valves of the heart with the patient supine. Again with both the bell and the diaphragm. I will now begin my abdominal assessment. I begin with an overall inspection of his abdomen. His abdomen is flat. His navel is midline. His stomach is symmetric. I don't note any lumps on outward assessment. I will begin with auscultation of his abdominal aorta. Renal arteries. Iliac arteries. And femoral arteries. With the bell. I now will change over to the diaphragm, and I will also take vowel sounds. Vowel sounds are present and normal active in all 4 quadrants of his abdomen. I now will perform both soft and deep palpation. Any pain there?
No.
No pain noted. I will palpate for liver and spleen. I'll have you take a deep breath for me. Okay, good. And again. Manual palpation and exam are normal. Liver and spleen are not felt. I will now have you to return to the stool with your back facing the camera. I'll check for CBA tenderness, and then we will begin our musculoskeletal exam. Okay, can you tell your tenderness with that?
No.
All right. In examination of the musculoskeletal system, I will be checking the joints of the fingers, wrist, elbows, shoulders, knees, hips, ankles, and toes. I'm looking for symmetry of the joints. I'm looking to see if there are any abnormalities, any crepitus, any nodules, that there is full range of motion and strengths with all of these joints. I will begin by checking capillary refills of his fingers. This is done bilaterally. I will also check radial pulses. Pulses are 2+. I now will check grip strengths of his hands. Grip strengths 5 out of 5 in his hands. I now will have him to perform some simple movements of his hands. I will have you to flex, extend, open your fingers, close, make a fist, and open them. Abduction, adduction, flexion, and extensions of his hands appear normal, as well as his wrist. I will have you to bring your hands inward and outward. Ulnar and radial deviation appear normal as well. I will have you push down against my hands. Good, and push up. Good. Strength of his elbows do appear 5 out of 5, and I will have you to push against my arms. Good, and pull. And 5 out of 5 there as well. Now we'll have him do some range of motions for his elbow. I'll have you to flex, extend, after extend. Good. That also is checking flexion and extension of his shoulder. I'll have you to bring your arms out. Good, and back down. Abduction and adduction of his shoulders. I'll have you to external and internal rotation of his shoulders. Okay. I will have you to bring your shoulders up and down. Alright, and assessment of cranial nerve 11, which is an accessory nerve. Bring your shoulder. 5 out of 5 strengths there, no abnormalities with cranial nerve 11. Also, while I have him in this position, we'll have you to look right, look left, up, and down. Range of motion of the cervical spine appears to be normal. Rotate cervical. Good. Now we'll check the sensory portion of his upper and lower extremities. I'll have you close your eyes and tell me where you feel me touch.
touch, 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 touch.
Senses of his bilateral upper and lower extremities do appear to be intact. I will also test stereognosis and graphessia. I'll have you hold your hand out for me. And with stereognosis, I will have you to tell me, with graphessia, I will have you to tell me what I'm drawing in your hand.
A circle.
Good. And with graphessia, I will have you to identify the object.
Battery.
And this one?
Paperclip.
Good. We will now move on to some range of motion exercises for the lower extremities, starting with his toes. I will check pulses in his feet. His pulses are 2+. I'll have you to dorsal flex, bring your feet upward towards my hands. Good. And plantar flex, place your feet down. Good. And I'll have you push against my hands. Good. And pull up against my hands. Good. 5 out of 5 strengths noted there. I will now have you to internal rotate your feet together this way. Good. And out. Ankles. Good. And with your toes, can you spread them apart? And bring them back together. Abduction and adduction of his toes. And I will have you to, can you bend your toes? And open them back. Flexion and extension of his toes. And I will have you to just make some circles with your feet. Good. Rotation of his ankles. Now we'll have you to push with your shins against my hands. Good. And pull back. 5 out of 5 strengths in his knees. I will have you to bend your knees back. Good. And bring them forward. Flexion and extension. I will now have you to try to open your legs against resistance. Good. And close your knees against resistance. Good. 5 out of 5 strengths in his hips. I will check the vibratory senses in both his upper and lower. You feel the vibration?
Yes.
Let me see your other hand. The vibration there?
Yes.
Also, we'll check the vibratory sense in his medial malleolus. Feel the vibratory sense there?
Yes.
And there?
Yes.
Good. We'll check the tendon reflexes bilaterally, beginning with the brachioradialis, bicep, tricep, patellar, Achilles, and Babinski. Again, on the opposite side, brachioradialis, bicep, tricep, bicep, patellar, Achilles, and Babinski. I will now finally have him to perform some range of motion for his hip. I'll have you stand for me. And can you bring your knee up? And out. And back in. Internal and external rotation of his hips. And I will have you to bring your legs across your body. Good, and back. And across. And back. Good, and twist for me. Good. I will also have you to bend down as far as you can. Don't hurt yourself. His spine appears normal. There is no tenderness felt. No scoliosis noted. I'll have you stand for me. And can you lean right? And lean left. Good. Forward. And back. full range of motion is noted with his lumbar spine. Can you close your eyes for me and bring your arms out to your side? This tests the Romberg. He is not swaying. His Romberg test appears normal. I'll have you take some steps forward. You can put your arms down. And take some steps back. All right, and hop on one foot. And the other. And that's it.